Hi everybody, in this video we're going to cover a normal CT exam of the thorax. Just before we start, a little note in radiology. Our right is the patient's left and our left is the patient's right. You can see here, this is the right side, this is the left side, this is anterior or towards the front, and this is posterior or towards the back. This is the little tray is not the right word, but this is what the patient lays on while the scan is taken. So when I start, the first thing I do is I take a quick look at everything. This is the soft tissue window, and then this is the lung window. I first start by pretty much following the IV contrast. So I'm going to follow this is the superior vena cava going into the right atrium. Blood is then going to flow into the right ventricle, into the pulmonary artery. And I'm just going to do a quick look at the smaller, more peripheral pulmonary arteries to see if there's any obvious abnormality. I don't see anything. We're going to go into the left atrium here. That's where the blood returns after going through the lungs, into the left ventricle, and then into the aorta. And here we can see a couple of the coronary arteries, your left main and your left anterior descending coronary arteries. We're going to follow the aorta superiorly to the aortic arch where it has its main branches, and then we're going to follow it as it descends through the thorax. Okay, next thing I'm going to do is look at the thyroid gland and look at the esophagus, and then I'm going to look for any lymph nodes, starting off in the axilla, on the right, on the left, looking at the base of the neck, looking anteriorly in the mediastinum. This is a normal thymus gland, and then looking more towards the middle of the mediastinum for any abnormal lymph nodes, and then along the hyla again for any abnormal lymph nodes. And I don't see anything. Everything looks pretty normal. We're going to switch into the lung window, and I'll look through the trachea and just briefly along the more central airways to see if there's any kind of obstructive lesion, and I don't see anything. I'm going to evaluate the lungs now. First I start off on the right, looking anteriorly. And then along the right lung posteriorly, and I'm looking for any kind of pneumonia or infiltrative process or any fluid or any kind of abnormal soft tissue structure. Moving on to the left, anteriorly, and all the lung tissue looks good. I don't see any abnormal pulmonary vasculature. Looking at the left lung posteriorly, again, everything looks pretty clean. We're going back to the soft tissue window now, and I'll look through the spinal canal and the neuroforamina to see if there's any kind of obvious mass. This is an easy place to miss things. I don't see anything. I'm going to look at the subcutaneous tissues posteriorly, along the right side, along the front, and then along the left side. And I'm going to look at the abdomen, and I evaluate the abdomen in a similar way that I would evaluate on a dedicated abdominal and pelvis CT. I'd look at the liver first, look at the spleen. This is a normal appearance for the spleen in an early contrast bolus timing. This is arterial phase timing. Look at the pancreas. That's normal. Look at the gallbladder. Look at the adrenal glands. These appear normal. And then look at the kidneys, and they both appear normal. And then I'll look at the gastroesophageal junction and the stomach, and for any bowel that I can see. And lastly, the vasculature down here also looks normal. Last thing I'll do, we'll come back up to the top, and we'll look at the patient in bone window. So I'll start off with the right shoulder, left shoulder, the clavicles coming medially towards the midline, the manubrium and sternum. Then I'm going to look at the ribs on the right side anteriorly, similar to looking at the lungs, and then the right side posteriorly coming up, and then the left side anteriorly, and the left side posteriorly, and lastly we're going to look at the vertebral column. And nothing sticks out so far, everything looks pretty normal. Lastly, we're going to go into the sagittal sections, and we're going to look at the spine one last time, looking at the spinal cord and the spinal canal, superiorly and inferiorly, and that looks good. And we'll look at it on the bone windows, and we can see all the facets and spinous processes line up well. Vertebral bodies line up well. There's no compression deformity and everything looks pretty good. And we'll also take a look at the manubrium and the sternum. And everything looks normal. So that is a normal CT thorax. I'll be covering a few other normal CT exams before I move on to some pathology. If you like what you see, then click on the like button, and if you want to see more, then click on the subscribe button. Thanks for watching.